We're now going to turn to our first panel to talk about the science of ultra-processed foods and how communities are helping eaters access healthy alternatives. So I'd like my panel to come up and I'll just introduce them. Joining me, we have Dariush Mozaffarian, the director of the Food as Medicine Institute at Tufts University. Round of applause. Dariush's a legend. We have Radha Muthiah, who is the president and CEO of Capital Area Food Tank. She's a legend too. Thank you for being here. And we have Anuraag Chigurupati. I'm going to mess up your name. Chigurupati. You want to say it?
Chigurupati.
Chigurupati. Thank you. I had it all practiced out too, so give him a round of applause. So, Dari, I'm hoping I can start with you. You know, in my opening remarks, I talked a little bit about sort of the impact of ultra-processed foods, UPFs. I'm wondering if you can sort of share the science behind these foods and why they're so, harmful to all of us.
Yeah, so thank you. So happy to be here with everyone and to co-host this with Danny and Food Tank. Ultra-processed foods are really a crisis in our country and around the world. The main insight around ultra-processing really came from a scientist in Brazil named Carlos Monteiro, who I've worked with quite a bit, about 15 years ago. And he thought, there's something going on with our food beyond the traditional nutrients. Yes, we need to focus on salt, we need to focus on sugar and some other nutrients, but there's something about the processing itself. And so he wrote a paper in Portuguese, being from Brazil. He said, I'm going to propose a new classification framework, which is based on the processing. The word for new in Portuguese, anyone know the word for new? Nova. So the Nova classification system, which you may have heard of, is it means new in Portuguese. And he said there's something about processing itself, not the nutrients, that's important. And so because of that, he started doing studies, and now there have been over 100 studies around the world, observational studies, but also 3 randomized trials in Japan, in the United States, the United Kingdom, all showing that even if you account for the nutrients that we all think about that we should or shouldn't eat, fiber, protein, carbs, fat, etc., processing itself has significant harms. And the mechanisms are likely multifactorial, but all of these mechanisms have been shown to be important in humans. And so one, of course, is there are some nutrients that are worse, salt in particular, sugar in beverages in particular, starch is in particular, not fat, but starch is a problem. But there's also other challenges. I think the biggest one is probably the acellular nature of ultra-processed foods. They have been molecularly disassembled and reassembled, losing their natural intact structure, which changes how they're digested by the body into the microbiome. Third, there's the actual additives. Many additives have direct harms. They can be carcinogenic, they can be endocrine disruptors, they can be obesogens, they can have many significant harms. Then there's contaminants from the fields, pesticides, contaminants from the packaging, microplastics and the processing. And then finally, there's the way they're marketed and packaged and the portion sizes and the way they're sort of made. I shouldn't say finally. And then finally, the hyperpalatability. They're also engineered to be hyperpalatable. It's not any one of those things that's important. You can't just say it's hyperpalatability or it's just sugar or it's just salt, or it's all of those things put together. And so this is the kind of biggest, I think, challenge in the US food supply is how do we start to reduce exposure and consumption of ultra-processed foods, and how do we have the food industry start to reformulate and create foods that are actually still convenient, tasty, but not ultra-processed?
Thanks, Dari. You mentioned Nova, but I am sort of puzzled why there is not an agreed upon definition of UPFs in the United States. Can you talk a little bit about that?
Yeah, so I'm excited that the federal government, this administration, has announced plans to create a federal definition for ultra-processed foods. I think that will be very, very important. In my own conversations with states, with many of my own peers, I'm a little concerned, actually, that some people are using this attention on ultra-processed foods as kind of a backdoor to go after saturated fat or sugar and salt. I just explained to you that it's not the nutrients that are the major issue. It's all these other things. And so the main thing I'm concerned about, Danny, is that some of my peers or people who mean well are going to get really excited that, like, this means we can go after sugar-sweetened beverages as the main issue, finally, or we can go after X or Y or Z or high-fat foods, in quotes. I'll put that in quotes. And I think that that's a big problem. And so the states have been innovating, but I think with mixed success. California has passed a law which has some really good aspects to it. They define the artificial additives and ingredients and processing methods really, really well, actually. But then they add additionally, criteria around saturated fat, sugar, and salts, which I think was a huge mistake. And it's actually a loophole for industry to drive through, just like they do for school meals, and make ultra-processed school food that meets nutrient criteria, but is still ultra-processed. So I think California started to get it right, and unfortunately, I think I pulled back. Pennsylvania and Massachusetts have proposed bills which are actually excellent. In Massachusetts, which is probably the best overall definition, they have all the additives defined by FDA technical criteria that should meet ultra-processing, and they add nitrites for processed meats, which isn't part of the traditional definition. I think that's an excellent definition. And then lastly, Pennsylvania, in addition to doing that, has an exemption. They say, look, not ultra-processed foods are the same. And so if an ultra-processed foods meets the definition of FDA healthy, which is actually a very good definition, it could be exempted. So I think this is the movement, and I hope that the federal government will really focus on the processing, not the nutrients, and follow the examples of Massachusetts and Pennsylvania.
Thank you, Dari. Thank you for setting the stage for this. Anuraag, I wonder, as the Chief Operating Officer at Devoted Health, I'm wondering if you can talk about the portion of medical costs that come from, that are tied to diet-related diseases. What are the numbers we're looking at?
I'm happy to speak to it. It's Devoted Health. We're a health insurer and a medical group that's focused heavily on prevention with the mission of improving health and life for seniors by caring for them like they're literally family. And so we focus really heavily on prevention, and it turns out about 73% of total healthcare costs for seniors are tied to preventable chronic conditions that are highly related to nutrition. So diabetes, heart failure, a number of others. And we found in our own data, part of what we've done over the past few years is to offer a grocery card of a couple $100 a month for about half of our members as a benefit. As we looked at the data on how grocery card utilization tied to healthcare costs, it turns out that of people who have high soda purchase rates and on our grocery card, we found a 14% higher rate of obesity, 16% higher just total medical expense across the board, hospitalization, specialist utilization, all of that. And maybe most shockingly, 31% higher rate of depression. So these probably won't surprise people in the public health world, but it just became very clear to us that addressing nutrition was really important to controlling chronic costs.
And so what did you cut the opportunity for people to buy soda or candy out of those grocery cards, right?
Yeah, that's right. So a couple of years ago, we started to look at this data, and it was clear we had to do something. What we realized we needed help, though. It's tough for any one organization to be the only plan out there in the market that restricts use of cards, and so we started advocating and working with CMS for clarification of the guidance that would come out. And so this year, there's been new guidance issued that's clarified that Medicare Advantage plans should not offer non-healthy food as part of the benefits. And so we were able to use that to restrict usage. And so starting in 2026, we're not going to have soda or candy purchases with the grocery card, which we think will help to really shift towards healthier purchasing behaviors and shift the nutrition and help us with our kind of mission of prevention.
Sure, and I know you've already thought about this, but do you anticipate a lot of pushback on that?
We were worried about it. We honestly were worried because I think often people don't like just constraints. But as we started to roll this out and announce it, we've just come to the end of the open enrollment period. As we started to share it, we found that brokers were applauding it. We haven't gotten the pushback we were worried about. I think people understand that nutrition's linked to their health, and so they're not maybe surprised to see a prevention-oriented healthcare company.
Yeah, it's kind of surprising, but it's good to see for sure.
And Danny, if I could just quickly add, all Medicare Advantage plans can do this. CMS has specifically said that non-healthy foods shouldn't be served anymore, but Devoted Health is actually one of the only ones that's following the rule. So most plans are not changing their offerings at all, and they're sort of daring CMS to do something about it. So I think Congress and CMS should both act to enforce the rule.
Thanks, Dari. Thanks. Radha, the Capital Area Food Bank has policies in place to make sure that you can offer neighbors healthy, nutritious food. And I'm wondering if you can talk about, how you developed those policies and if you've had pushback.
Sure. The Capital Area Food Bank covers the greater Washington area, and we provide food to about 1.5 million people who needed a little extra assistance putting food on their tables. It has always been clear to us that addressing hunger alone is not really the core of our mission. The core of our mission extends to addressing hunger and improving health outcomes. And so having that be a part of the mission has really clarified the kind of food we accept, the kind of food that we distribute. So about 10 or 15 years ago, we made the move as the first food bank in the country to say we will not accept certain types of foods that are high in sugar, high in salt, low in fiber, et cetera. And there was a lot of pushback at that time because it was a very controversial decision with a lot of people on both sides. Some people saying food is food. People are hungry. You should accept that. And we said as long as we can provide enough food to those who need it, we would prefer to provide nutritious food. And so we took a stand on that. And gradually, over time, that has become more acceptable, and food banks across the country are doing that. In our case, we're very focused, to Dari's point earlier, on fresh produce and protein. So 40% of everything we distribute, and we track it daily, has to be fruits and vegetables. Another 10% at least is protein. Could be vegetable-based, it could be meat-based. So that is important. And we have seen through some of our other programming and our partnerships with hospitals how important that is and how you can really move the dial on health outcomes, especially with diabetes, hypertension, cardiovascular disease, high-risk pregnancies. We've seen incredible outcomes there as well. So we know the impact. And to what the congressman said earlier, our population is those who understand and know the choices that they should make. It's just they don't have the ability financially to make those choices. And so we try and facilitate that so that they can make the choices that they desire to make and to take care of themselves and their families.
Yeah, thank you. You're also doing something that other food banks aren't doing. You're tracking the nutrient content of these foods. And I'm wondering, is this a model that you anticipate other food banks will follow?
Yes, it's, as I mentioned, for us, it's we don't get as much food donated that fits into the categories that I just spoke to, right? We don't have enough fresh produce that's donated to us or protein. And so we use our philanthropic dollars to purchase all of those items. And increasingly, as more and more food banks are doing the same, there is a greater understanding of the importance of that and the fact that you can really address multiple outcomes. So we see increasingly foundations and others who traditionally may not have been focused on food security, but are focused on healthy lives and healthy people and community health, increasingly being engaged as well. I think the other thing that's important to mention is how we really work with hospital systems, with federally qualified health centers, with community care clinics to track the health outcomes and to track the cost, because ultimately it becomes very important to show that nutrition is a cost-effective intervention so that more plans can really take that on. So we're not just tracking what those health outcomes are, but we're actually measuring how expensive it is. And in this case, not so expensive, to be able to offer nutrition as an intervention to improve health outcomes.
Thank you. Anuraag, if I can turn back to you. You described the work that Devoted Health has been doing on the role that food plays in healthcare as a journey. And I'm wondering if you can sort of describe that journey and how you came to be where you are now.
Yeah, for us, I think it started in 2020 at the start of the pandemic, as we as people locked down. We wanted to make sure we were that many of the seniors in our plans had all of their medications and medical equipment and other things kind of taken care of in that moment. So we started a massive campaign to just place phone calls to all of them. And as we called, the thing that actually came up more often than anything else was food, understandably. And so that was the beginning for us of the journey towards understanding more deeply the role that food played in the overall health picture for the population we serve. Over time, that led us to prioritize kind of access to nutritious food as a benefit, which is what led us to want to offer the grocery card as part of our health insurance benefit offering. And then, as I mentioned, as we started to see how people were using that, and then see the association between the particular types of foods that they were purchasing and health outcomes, that's led us now onto this journey of trying to nudge and incentivize people towards kind of food purchases and food consumption that does more to promote their health, and also working on sort of counseling and other coaching, particularly for some of our programs focused on diabetes or hypertension.
Sure. What does that counseling and nutrition education look like?
Comes in a few different forms. So there's a Medicare covered benefit for medical nutrition therapy, and we offer that very broadly. And I think up to 3 visits a year are covered with a registered dietitian through that program. And so we've partnered with some organizations that provide virtual counseling to do that. We also I lead operations for our medical group. We have particular programs focused on patients with diabetes or hypertension, and that looks like working really intensively with them over the course of a couple of months, meeting with them every week, talking through food choices, adjusting food choices, and then seeing how that shows up in their blood pressure or in their blood sugar for diabetics, and then sort of over time that we found that leads them to the quick feedback loops combined with what they're changing on nutrition have really make a difference.
That's incredible. And those registered dietitians, for all of those RDs in the room, shout out, because you have such a critical role in all of this. Give yourselves a round of applause, dietitians. Dari, Anuraag was talking about how COVID opened so many people's eyes to the connection between food and health. But when we're talking about UPFs, ultra-processed foods, they tend to be less expensive than, healthy, nutritious foods. And, especially right now, a lot of eaters are struggling to put food on tables. How do we balance the affordability of these foods with, the health outcomes that they're creating?
Yeah, it's an excellent question. Ultra-processed foods are overconsumed by all strata of society, but particularly, Americans who struggle based on geography, income, education, nutrition literacy, disability, other issues to eat a healthy diet. For me, I think the most important thing is to use the investments we're already making, to use those investments, to shift those investments towards healthier food, and that then leads to kind of a wonderful virtuous cycle all the way down the supply chain, including to American farmers, to help support American farmers. And so just looking at my amazing panelists here, the Medicare Advantage plans, it's hard to get a single number because they're all different plans, but my estimate is about $10 to $15 billion a year are being spent right now on these grocery cards. That's not small change, right? And these grocery cards mostly are just buying junk food and whatever happens to be advertised. And so I think shifting that $10 or $15 billion to healthier foods will drive market responses and supply and other things. Similarly, food banks, if people have this sort of view of food banks from 30 years ago that it was all like, processed foods and junk food, go visit the capital area food bank. It's not your, grandmother's food bank anymore. The food banks have been a leader in thinking about turning to not just food security, but nutrition security. And so all of those dollars going through. And as I think we'll hear about on the later panels, we have SNAP, $100 billion. And then we have all of healthcare. Healthcare is $5 trillion. We spend about $1 trillion on groceries in the US, and we spend $5 trillion on healthcare. What if we took $100 billion of that $5 trillion we spend on healthcare, just $100 billion to address the top cause of poor health, which is poor nutrition? That's 10% more dollars for their entire grocery spend that we could spend on healthy food. So, and especially targeted that to low-income Americans, struggling Americans. So to me, like as a physician, I'm a cardiologist, the healthcare system is important, but we are spending a lot of money and have the worst health outcomes of all high-income countries in the world. Let's shift all these investments towards healthier food for everybody, for all Americans, but particularly for lower-income Americans. Absolutely.
So we have about a minute and a half left. I would like for each of you to take about 30 seconds. We're in a room where so many important decisions are made. To take 30 seconds to give a call to action to policymakers about what they should do on the issue of ultra-processed foods.
We'd love to keep working with CMS and others on just really focusing on prevention of chronic disease as a priority and helping steer towards incentive structures and regulations that encourage the healthcare system to move in that direction.
Thank you.
Not too dissimilar in terms of really looking at different types of interventions like the 1115s and others that allow for Medicaid in particular to be able to reimburse for good, nutritious food.
Thank you.
Yeah, well, Danny, you mentioned the room, and we should thank the Senate and for giving us this amazing, beautiful room, and for all the congressional staff and others who are here. Thank you for being here. So I think first and foremost, this has to be in the top, 2 or 3 priorities for Congress. Period. I mean, Congress is thinking about the economy and jobs and healthcare spending and national security and all these issues, and somehow food is missing from the conversation in many offices. This is the central issue of our time for our economy, for our health, for our future, for our kids. So number one message is just put it on your agenda and think about ways to work. I think second, this is a bipartisan issue. This is actually an area where both parties, 3 parties, if you want to count independents, everybody can get together and really work on common sense policy. And we've seen that with some bills that have been introduced by Senator Marshall and others, by Congressman McGovern and others, Senator Booker and others. There's some real bipartisan action here. So let's get those bills passed. And then I think third is to really use the investments we're already making. Again, we're already investing hundreds and hundreds of millions of dollars in diet-related disease care and for food in various ways. And so let's use those dollars. We don't have to use new dollars. Let's use those dollars to pay for healthy foods. And then specifically in ultra-processed foods, I think, as we'll hear about, I think FDA has a lot of exciting things they can do from an administration perspective that doesn't need legislation. So I hope that the administration moves forward aggressively and following the science.
Fantastic. Great point to end on. Please give these panelists a round of applause.